Welcome to the CIN webinar, Compassionate Leadership in Times of Crisis, Anchoring in Your Purpose. This is the first webinar in a four-part webinar series that combines inspiration and relevant tools and resources to support healthcare professionals in staying resilient. So my name is Marie Hubbard, and I'm the program manager for the California Improvement Network, also known as CIN. CIN is a learning and action network focused on advancing the quadruple aim by identifying and spreading better ideas for care delivery. CIN is fueled by the energy and innovations of its partners and members. CIN is one of the only communities in California that brings commercial and safety net healthcare providers, health plans, and quality improvement organizations. CIN is a project of the California Healthcare Foundation, managed by Health Force Center at UCSF. The California Healthcare Foundation is dedicated to advancing meaningful, measurable improvements in the way the healthcare delivery system provides care to the people of California, particularly those with low incomes and those whose needs are not well served by the status quo. Health Force Center at UCSF is an organization dedicated to helping healthcare organizations drive and navigate change. The efforts of Health Force Center are focused in the core areas of capacity building, leadership development, and workforce research. So a few tech tips for this Zoom meeting before we get started. Everyone is on mute except for our presenter. If you'd like to ask questions or share a comment, please use the chat box located in the bottom panel of your screen. We'll try to get to as many questions as we can within this hour, and we'll have time towards the end for those to ask questions. This webinar will be recorded. If you're having specific issues or have a particular question about using the platform, you can direct message my colleague, Christina Travlos, and she'll be able to answer your questions. So now I'd like to introduce our presenter, Dr. Leah Weiss, who's a lecturer, researcher, and author who teaches at the Compassionate Leadership Program at Stanford's Graduate School of Business. She's also a founding faculty member of Stanford's Compassion Cultivation Program. I'll now pass it off to Dr. Weiss to get us started.
Hi, thank you so much, Marie. It's a pleasure and an honor to be here with all of you today. We are in an unprecedented moment in history, and I think it is more important now than ever to pay attention to this topic of resilience and compassion. So that will be our focus for today, the role of purpose in building resilience. I'm going to go ahead and start sharing my slides. So today's topic will be compassionate leadership in times of crisis, specifically anchoring in your purpose. And in this session today, I'd like to put in memory of my cousin, Dr. Larry Glassberg, who passed away this week, who was an internist at Columbia. And I want to share a definition of compassionate leadership, springboarding on the physicians' COVID-19 memorial board, where patients and coworkers are leaving notes for people who've been lost so far in the fight against COVID. And I was struck when I read that page for my cousin that the word compassion came up over and over and over again. And unlike me, he wasn't a person who talked about compassion. He was a person who did it in his work. And it prompted me to update the definition of compassion that I use. And I'd like to start by sharing that with you. Compassionate leadership is respecting the dignity of others, acknowledging the pain in the room, and recognizing that people who are valued create value. So let's all aspire to do that no matter what our position is. We are all able in the interactions we have to bring forward more compassion, and anchoring ourselves in our purpose is a key way that we can do that in stressful times. So a quote from Viktor Frankl from his book, Man's Search for Meaning, about resilience really in the context of the concentration camps in the Holocaust. He says that those who have a why to live can bear with almost any how. So we are in a time where we need to be more clear than ever on our why. And that's really the topic we're going to address today. It's not easy. We're moving at quick paces. We're doing more than one person's job on average. And this was pre-crisis. We were doing 1.3 full-time jobs. So 100% of my job and a third of another person's job. So our lists are long. It's hard to prioritize. And we can't wait to reflect on purpose or de-stress until our lists are complete, because that day will never come. We need to learn to do it in the midst of all of the busyness. And you see, if you look at the research on workplaces, that we are in a time where microaggressions are on the rise, when outright hostility and bullying and even violence in the workplace are on the rise. And what we know is that in a time where there's extra pressures, there's a fork in the road where we can rally together behind purpose, or our teams can fall apart in stress and in hostility. So it's an important moment to ask ourselves, what are we doing as leaders? And it doesn't matter if we have people reporting to us or we're a collaborator. We're all leaders in our ability to set the tone with the people we're working with. We're also in a time where there's an extra layer of stress, in that for those of us who aren't frontline workers, we are mixing and matching together all the different aspects of our lives in ways that many of us are unaccustomed to, from working from home, blending family, work, needing to make quick decisions around the clock and be accessible at a time when many of us have children who all of a sudden have a lot of needs, and families and relatives, not to mention background fear. And if you look at the top challenges that employees were reporting, and this was a recent summary from LinkedIn prior to the crisis, and what you see, and this is only amplified now, is that of course we're all struggling with email, and we want to make sure we're being paid fairly. But if you skim down the rest of this list, having people we can turn to, finding purpose and passion and ability to develop in our career, dealing with difficult managers, politics, policies, difficult coworkers, these are the things that we struggle with. They're people skills, they're soft skills, they're interpersonal skills. And so I want to ask you at this moment, when you think about your current relationship to your work, can you summarize this in 3 words and put it in the chat bar? So to give examples, I put in the slide 3 examples: maybe challenging, maybe meaningful, maybe stressful. Can you go ahead and put in this chat bar here, what are your 3 words that you would use to describe your relationship, how you're feeling about your work today? And you can go ahead and put that there, and we'll take a look at how others are doing, how we're doing. Challenging, demanding, exhausting, challenged, lonely, roller coaster, essential, thankful. So look at these words. And I think one thing that really stands out is there's a lot of common feelings happening here. And there's a mixture of demanding, exhausting, and rewarding, critical, right? So we're balancing both purposefulness and exhaustion. And this is something that we'll continue to speak to and address today. And I am going to put some interactive exchanges in this webinar, so you don't just have to sit back and listen and think, but I'm hoping that by the end, you'll have a couple of tools and resources that you'll be able to take forward. So in terms of context, we know that, and this was even prior to the crisis, that we're in a time when in healthcare, in particular, rates of burnout are so high. And burnout is defined as emotional exhaustion. And we see a lot of people talking about exhaustion in this chat bar. Depersonalization, which has to do with kind of dehumanizing either ourselves or others, often as a result of stress. And then reduced personal efficacy. And it's particularly prominent in helping professions. So to boil that down a little bit further, I think it's critical for us to understand the difference between when we're veering towards resilience, when we're veering towards burnout, so we can catch ourselves and we can move ourselves by using resources like purpose. So Dr. Masloch, Professor Emeritus at UC Berkeley, describes in an important way this dynamic of burnout. We should be trying to identify and analyze the critical components of bad situations in which many good people function. Imagine investigating the personality of cucumbers to discover why they had turned into sour pickles without analyzing the vinegar barrels in which they'd been submerged. And I think this metaphor of we can't blame ourselves for the exhaustion, even though we experience as individuals, when there's these elements of burnout, we experience them as individuals, but it's about relationship to our environment. And I think de-identifying can actually, understanding how we can influence our environment is a critical way that we can have influence to move not just ourselves, but our teams and organizations towards resilience. And burnout is taxing our society heavily. We see costs in the billions. We see productivity rates tanking and profitability tanking. It's also in the context of healthcare, burnouts associated with medical error, with lower patient satisfaction, and so on. And there's individual human costs, risk of heart disease, the threat center of the brain, the amygdala, actually increases in size, and we have less access to the cognitive functioning. We think less clearly, more likely to contract diabetes, accelerated biological aging. And I promise I'm not just going to go off on the negative this whole time, but I think it's critical that we understand that burnout is a possibility. Burnout happens in our environment. We need to understand it so we can be resilient. We don't need to go into all the details of this 12-stage continuum, but the point I want to make here is that late-stage burnout that has this kind of dramatic collapse has a lot of steps before it, and some of the earliest steps can mask themselves as workaholism, pushing ourselves harder. It's part of what makes this a frog in a pot dynamic, so we need to be aware of the signs and stages of burnout, not just in ourselves, but so that we can keep our teams resilient and support our coworkers, the people who report to us, because if we catch ourselves and one another early on, we can do a lot. If we wait until we get to stages 11 and 12, it can take years and months to recover. And in the pre-program polling that we did, we asked you, this group here today, actually the most predictive question in the burnout inventory. And to analyze where this group was in this slide, 21% said, I feel like my job is breaking me down, never. And then you see where this goes. 31% said once a month, 36% once a week, 10% said more than once a week, 2% said every day. And so basically above the once a month mark is considered to be at medium to high risk of burnout. Just so you understand where you are, and my hope is that not to internalize this to make you more stressed, but to understand the importance of taking time to look at this topic and move some of these levers we're going to talk about today. So one of the things that we've created out of the research on burnout is a resource that you could look into, which takes your personal coping style into account and to understand how you personally have risk factors and strength factors that will help you drive towards burnout or resilience. So this is a quiz you could take either as an individual or share it with your team. And you can find the link at the bottom of this slide, Skylight.io self-assessment. And the point of the quiz and the point of transitioning from burnout to resilience is understanding that we have to think in terms of energy levels like battery or sustainability. We need to understand what gives us energy and how we're dealing with things that take away energy. And we'll talk about purpose as one of the ways to go about that today. And in the rest of the three-part series, we'll explore mindfulness, self-compassion, and compassion as additional ways to charge our battery, if you will. So let's pause here, and I want to invite you to do a writing exercise for 1 minute. And what I'm going to have you do is first write about a time, and it might be today, describing what it feels like to be drained. What caused this to the best of your ability to name? What impact is it having on you physically, mentally, and how are you responding? And I'm going to give you just 1 minute to basically free write about this topic of trying to identify causes, impact, and response to a time that you felt drained potentially today as part of this self-awareness building process. So 1 minute here. You can go ahead and jot down notes on a piece of paper, type into your computer, or just sit and reflect. And I will time us here for 1 minute. Another 10 seconds here. Okay, so what I'm going to invite you to do is put any observations you have when you read through this, look at what you just wrote, you skim back over it. What stands out to you about your experience of being depleted? What do you notice when you journaled and when you read back over it? And go ahead and put some of your comments in the chat bar. And thank you, Jeffring, about this comment about soft skills. I agree, it's not a term that I use when I'm writing. It's a term that's used in the literature, which is one of the reasons I'm using it. So for people who, like me, are kind of nerds for wanting to find primary research or look in PubMed, this is a place where you can, it's an identifying term. I prefer thinking about emotional intelligence or social intelligence and so forth. It's an important point you're making, so thank you. Okay, so go ahead when you're ready and put a note if you want to in the chat bar about that first exercise. Now I want to shift the topic and let you write for another minute. And this time I want you to write about a time that you experienced purpose in your role. Purpose in your role at work. Okay, so it could be an exchange that you had with a coworker. It could be, you determine, it could be small, it could be big, but a time that you felt like this experience reminded you that there's purpose that helped you identify your passion in your work. So we're going to take 1 minute here and do another, either write on a piece of paper, write on your computer, or just take a minute to reflect and recall a time that you felt purpose in your work and remember what caused it, what impact it had on you. And we'll take a minute here now to explore this, a time that you felt purpose in your role. Another half minute. You could explore the context, how it felt emotionally, physically, how it propelled you into follow-on behaviors. Okay, that was a minute. So if you want to go ahead now and take a look at that or reflect back on what you just thought through as an example of purpose, what stands out to you about this purpose example? Can you identify a value that this purpose demonstrated? So the first comment that came in here, and thank you, inspiring others felt purposeful to you. So let's take that example. What is a value that's in inspiring others, right? That you could name for yourself. And part of amplifying purpose is getting clear on examples of purpose that are happening, but the core values that purpose is demonstrating. Helping others, inspiring others, providing hope, instilling continued energy to move forward. These are great. Giving back through teaching and inspiring. Yes, so being an educator. So what are the values as you look at these? You could continue, that would be a follow-on exercise that you could, and interesting, right? If you scroll back up and compare and contrast between these 2 minutes here, when you focus on what it feels like to be drained, and when you focus on an example of purpose, how did purpose impact your energy level, right? These are follow-on questions we could explore, and these are the kinds of questions, and I'll talk about the purpose research more now, that we do explore when you're doing interventions to increase purpose. So clarity and purpose is one of the greatest weapons against burnout at all levels. So at the individual level, helping us prioritize, clarify, simplify, endure, back to that Viktor Frankl quote. From a team level, helping us align on what matters and putting our time there. If we're aligned on purpose, unity becomes much more possible. And then from an organizational perspective, a culture-wide, role clarity, alignment of values, these help organizations build purposeful cultures. And so interestingly, you know, purpose would be a nice thing to talk about maybe, but if we couldn't increase it for ourselves as individuals and organizations, wouldn't be particularly practical. But it turns out that purpose can be trained, and you see courses happening all over the country and world where researchers who study the topic of purpose are bringing this into the education and management programs, undergrad life, and so forth. And I'll talk more about the work coming out of Yale in particular in a few minutes. So the model that I'm sharing comes out of my experience in looking at positive psychology research, particularly intersecting in this question of compassion. And I spent my 10 years in and out of grad school, also training in traditional Tibetan Buddhist techniques or pedagogy in the context of 100-day and 6-month retreats. So my approach to this, especially early in my career, was very much from a contemplative education point of view. More recently, because of all the breakthroughs happening in terms of mindset and so forth, I've taken a much more on the spot, in the job, in milieu kind of approach, and that's the emphasis I'll be sharing with you today. So the framework, and this is actually the framework we'll be covering in this webinar series, starting with clarity and purpose, because a purposeful leader can drive compassion in themselves, in their teams, in their organizations. We need mindfulness, not in the kind of woo-woo perspective, but in the ability to focus our attention, cope with difficult emotions and distractions, to stay aligned with compassion and purpose. We need to deal with our relationships with ourselves. For many people, negative perfectionism, self-criticism takes up so much bandwidth that there's not capacity left to be compassionate to others. And then compassion itself has a whole set of research, both from an individual health, individual intervention, and group organizational perspective. So in the upcoming webinars, we're going to double click on each of these topics. But today we're focusing on purpose. And so what you see, if you look generally in this country, the data is that over 50% of people, when asked, cannot answer the question, what are you supposed to be doing at work and why? So of course, we're having a crisis in workplace engagement. It's difficult to know the forest for the trees if we don't understand how our specific role is playing a part in the bigger picture. And you would think that a field like healthcare would be exempt from this, except for the fact that there's some roles that you know, clarity in how one fits in with the helping side is not so obvious. And then for people who are on the direct care side, they also can have elements of their role that lead them to struggle when they can't provide the level of care that they want to, or allocate time or treatment because of issues with insurance or other administrative challenges, let's say. So purpose is actually relevant throughout. What do I mean by purpose? I actually want to be really specific with a definition. And the definition comes from Barb Fredrickson, a pioneer in positive psychology, who says that purpose is a far-reaching, steady goal, something personally meaningful and self-transcending. So it's got to be bigger than me, but also relevant to me. And it has to be beyond the items on my to-do list, but ideally my calendar, where I'm spending my time, my to-do list are moving me towards this larger purpose. Puzzle piece metaphor that we need to understand that there's no proverbial box top in the sky. So part of our role as leaders, as team members, is when we don't have the clarity about why we're doing something, that we should take the time when it's possible to ask and answer that. And for leaders, it's critical for us to not skip over the step of making sure that people understand the why behind their work, because when they don't understand it, there's all kinds of outcomes that will follow on. When we talk about purpose, there's two key terms that might take you back to like undergrad philosophy, or maybe you've been reading happiness research more recently, so you might have come across it there. Eudaimonia is this, comes out of the 2,000-year-old debate about what does it mean to live a happy, productive life. Eudaimonia is the meaning-driven, other-oriented service perspective on creating happiness. When we do something meaningful, a side product is we experience happiness or purpose. And it's contrasted with hedonia, which is related to the term hedonistic. And it has, hedonia speaks about like positive affect, so feeling good in the moment. And I want to share with you an example of the kinds of really interesting research that are happening in this space of purpose. So this is a seminal study that's been replicated with larger sample sizes. Barb Fredrickson on the left, Dr. Fredrickson, partnered with Dr. Steve Cole, who's at UCLA, to ask the question, what if we operationalize this debate about eudaimonia versus hedonia to understand which approach to life makes people happier and healthier? So the upshot is they took a group, divided in the group in half based on their answers to questions that basically put them in a hedonic or eudaimonic group. And so let's pretend we were physically all together in a room. Half the room sorts to a hedonic perspective. They're really driven towards positive experiences. They're going to go, skydiving on their next vacation. They look for pleasant affect is really important to them. The other half of the group are really meaning driven. When they're outside of their healthcare service-oriented job, they're community volunteers. They care a ton about giving to others, and they find that their way to feel better themselves in a meaningful way to approach life. So what they did was, Dr. Fredrickson is an expert in self-report. Dr. Cole is a genomics professor. So they did a self-report and giving people surveys, and then, as Dr. Cole puts it, poll the opinion of the human genome. So what they found with the self-report is that basically both groups, hedonists and the eudaimonically oriented, equally happy, or because it's academic research, as many of you will appreciate, it's the double negative of equally not depressed, equating to happiness. So that's interesting. Didn't really matter if you were hedonically or eudaimonically oriented in terms of your self-report about your happiness level. But at the molecular level, it mattered a ton. So the eudaimonic group had lower inflammation, higher antivirals. There's a specific sequence I won't go into all the details of, but if you find this interesting, you can find some great articles from Dr. Coles, and I write about him in my book a good deal. There's a specific sequence he's been studying in cancer research, HIV, AIDS research, overlaid with resilience, called the CTRA sequence. And basically, this is a really predictive sequence about your longevity and health outcomes. And the eudaimonic group was in great shape. hedonic group, higher inflammation, lower antivirals, and their CTRA sequence, as he put it, is a molecular soup of death, not good. So the upshot is that our self-report is moving in opposite directions. So we think we're happy, but we're not as healthy if we lack eudaimonic purpose. But the other really critical finding from this study, which is why I said it was seminal and has been replicated and pursued, is this idea that purpose makes us healthier, not just feel better psychologically, but that there's a health imprint. So you see this, I'm not going to go into all these sub-bullets, but it makes the point that there is a huge impact on our physiological health when we are higher in purpose. Everything ranging from salivary cortisol to inflammation levels, cholesterol, sleep, and even risk of mortality, disability, Alzheimer's disease. And then of course you see an uptick in terms of mental health outcomes for people who are more purposeful, life satisfaction, and you can see down this list, less distress, less anxiety, greater connection with others. So purpose impacts us physically, mentally, and of course physical and mental aren't as separate as people once believed, and that's really one of the other interesting parts of the research in this space. In terms of purpose and workplace outcomes, you see purpose impacting motivation, absenteeism, so calling in sick, how we behave when we're at work, how engaged we are, how satisfied we are, how empowered we are to take strides that are meaningful, and stress levels, how much we identify with our organizations, and so forth. And so all of those translate to the bottom line, basically the business case for purpose. And I think it's critical to remember, as I started in the beginning, that purpose is an antidote to burnout. Burnout is not just an individual problem. We need, when we're thinking in terms of amplifying purpose, to engage at the individual level. Yes, we need to clarify and increase our purpose, and that's what we're going to spend more time on today. We also need to think within our units we work in. What are we doing to create more purpose as a team? And there's a lot of really useful information about how we can do that better. And then culture, organization-wide, what can we do to amplify purpose? So I'm about to take a turn that you might say, wow, she's really losing it. But I promise there's a reason for this. I want to talk with you for a minute about zookeeping. Zookeepers have an extremely high sense of calling in their work. And they say things like the quote on the left that you'll see, I don't know how they could make me leave. Even if I wasn't getting paid, I'd come here because I care about the animals. I care about conservation. Low pay, they make on average about $20K a year. There's not a lot of job growth because there's not like a ton of departments and managerial levels. And in fact, people want to work with the animals directly. Lots of volunteer work. 82% have college degrees and all that implies in terms of student loans and whatnot. But when you interview this group of people, there is a huge sense of occupational identification, kinship with their colleagues and animals, that they are purposeful, that there's meaning and significance in everything they're doing. And so this is where I'm going to suggest the parallel, that having a calling can be a double-edged sword, because while there's all of this positive engagement that comes out of it, there's also this sense that rejecting a calling would be more than an occupational choice. It would be a moral failure, a negligent abandonment of those who have need of one's gift, talent, and effort. So the point I'm making here is that when you're in a field that is so purpose-driven, there is the upside in terms of engagement, but there's also can be this loop between self-sacrifice and burnout that we need to be highly attentive to as individuals, as managers, as organizations, especially because the rates of burnout are so astronomically high in healthcare, and that was going into the crisis. So I promised that I'd talk a little bit about the research coming out of Yale, because I think it is some of the most interesting. And this next set of slides refers to work from Dr. Amy Wrzesniewski. She teaches at the Yale School of Management, and she's been studying purpose in organizations for decades. And one of the frameworks that she uses in her research is this idea of job versus career versus calling. You could think of these as three distinct mindsets towards work. So a job is exchanging time for financial remuneration. And if someone was financially secure, they wouldn't continue doing that current work because the point of the work is about making money. Now, I just want to flag, because this can be off-putting without more context, maybe that sounds judgmental. She's actually, her research specifically seeks out finding people in positions that you would think, you might say, oh, well, the CEO and the C-suite and the executives and people who have control over their time and who have a lot of money, they would have the calling, and people who are in more difficult situations have a job. That's actually not the case, and I'll tell you more about that in a minute. So job is more focused on exchange for money, but that also contains dignity. We need to support our families, often extended families, and so on. Career is about advancement. I view my job as a stepping stone to other jobs. And then the idea of a calling. My work makes the world a better place. So fulfillment from the work itself as a possibility. So 2 ways I want to suggest that this framework is really practical, and then I'm going to play it out for you in the next slide to give you a little bit more color. One way it's helpful is to ask ourselves, where are we? And maybe we're not just in one place. Maybe there's parts of our work that we would say that's definitely a job, and there's other parts that feel like a calling. Where are we spending most of our time, in which mindset? And then being aware of where we're in a job, and so we can particularly pay attention to the idea of the puzzle box top, reminding ourselves of how the job fits in with the bigger purpose more proactively. So there's this working with ourselves and our mindset piece of this framework, but there's also managing and motivating others. A very typical mistake that people make is to manage others as though they have the same orientation that we do. So if we're in a calling, but somebody else is in a career, speaking in terms of mission isn't going to translate to them in the same way that speaking in terms of opportunity and advancement and learning in the kind of career mode would. And so if we're finding we're often people who are in a calling or career are frustrated by coworkers who they perceive to be in a job. They're not going to give their all because their idea is different about what they're there to do. So paying attention to what are our assumptions, not just about ourselves, but the people around us, and how can we be more precise in framing things that help people draw them into an invitation to a calling, but also meet them where they are for motivation. So I want to share a specific example of a study from Dr. Wisniewski. So she did in-depth interviews with janitors in hospitals. And what you see in these interviews are a range. You see some people talking in terms of a job and supporting their family, extended families through their work with great pride, as they should. Some people speaking in terms of a career. They had an example of someone who had been in their role, maybe a night shift janitor who's now a facilities manager, and they know them, they saw how their career progressed, and they're moving towards that same goal. And then there's some people who describe themselves, and this is a direct quote, as an instrumental part of the care team, because if they don't do their job well, infection will spread and people will die. I mean, never more obviously true than right now, right? But the point being that same job, different mindset towards the job leads to different workplace behaviors. So people who view themselves as having a calling, the approach, the engagement that they take to their core job function is going to be much higher. They're much more engaged, but they'll also do what we call in the research extra role behaviors, where they go above and beyond for things that are not part of their description of their role. So you see examples along the lines of a janitor who would, in the middle of the night, spend time connecting with a patient, hearing their story, supporting them, keeping in touch with letters after they left, or coming to a funeral if they passed away. These are critical extra role behaviors is an important for those of you who are managing other people or wanting to create more meaning in your own work. The question that we need to ask ourselves is, where can we find opportunities to both bring in more purpose, to what we're already doing and link it clearly to what matters, but also opportunities to lean into doing things that aren't part of the core job description because they matter to us, because they matter to the environment. And then for managers, what are you doing? A great manager is aware of what lights their employees up and where they find purpose and helps unlock opportunities to do that. And the cost of not doing that means rollover and losing critical employees. The opportunity of doing that creates much more engagement and longevity. And we all know retention is one of the most costly problems an organization can face. So food for thought in terms of job career calling. And then if you look at the research on purpose, there's kind of two buckets that we see. There's top-down writing, personal mission statements, getting more clear about what matters, and bottom-up pattern recognition, understanding our values, crafting our jobs. And this includes things like engaging with the emotional or passion piece of a role, that we are humans at work. And as humans, there's things we care about and can be drawn out on that will make all of our work and relationships more powerful. So I want to give you an example here, and we can do a really brief version of this now to get you started on this idea of crafting a personal mission statement. So if you were to do this in a longer form, what that would look like is sitting down with someone, and it could be by Zoom, and asking one another to describe a time you felt purposeful in your work. We actually did a version of that in the earlier writing assignment we did. What were you doing? What about the experience made it purposeful for you? These are questions you could draw yourself or another person out on. Asking questions around who in your network you experience as most supportive, who uplifts you, who energizes you, who treats the people around them with dignity and compassion. And then there's another piece of this you could explore: what brought you to this work you're doing now? Why did you come into healthcare? Of all the choices you could have made, what was it about this that attracted you? What impact did you want to have? And how are you living out the impact or absence of impact now? These are all, if you look at purpose research from people like Bill Damon at the Stanford Graduate School of Education, who's been studying how to increase purpose for decades, these are the kinds of questions that are demonstrated over and over in studies. When people take time with these, with clarifying their values, you get more purpose. So here's the truncated kind of template version that I want us to all experiment with, kind of intentionally a quick first draft of this now, to string something together for yourself of a personal mission statement. So let's use this template here. See at the bottom, my sense of purpose is linked to blank. So just go ahead and write down or think through, what is your sense of purpose linked to? What activity energizes you? In conjunction with, or for, which group of people? Can you write that down? To accomplish X, the impact you want to achieve. And if you can write out, fill in the blank, this will give you a starter first stab at a mission statement that you could flush out with the questions I was describing in the prior slide. So I'd be curious if you have, out of doing this exercise, if you can want to put any examples of what you just came up with in the chat bar so we can share them with one another. And so let me show you it one more time to make sure that you got a chance to see. So my sense of purpose is linked with this activity in conjunction with or for this group of people to accomplish this impact. And so look at these examples that are coming in, linked to connection, to helping others, to better care. And you could write this out and have it by your computer, right? That you could have this personal mission statement as something you're remembering. And when we all end up, whatever the tasks that we do that in our work fit into the job category, reminding ourselves what we're about, why we're doing it, how that task ultimately fits in with this bigger picture. And then we can double click on some of these questions like I've been asking around, what are the underlying values? What are the values underneath our purpose that we could get at? And asking the people we work with now more than ever is the time we all need to reconnect with purpose. So you could start your next meeting or huddle, asking people to share examples of a time they felt purpose or they felt like they were contributing in a meaningful way in the context of the crisis, right? Like taking a few minutes to touch in on these things can increase morale in significant ways. There's a lot we can say. This is a summary slide I wanted to share with you about the topic of purpose and preventing burnout with a definition. We talked about how to define purpose, eudaimonia, it's not hedonia, how people don't feel a sense of purpose at work, why it gives us benefit, how it protects us from burnout, how we can increase purpose in our teams and organizations. We looked at reframing our careers and the example of the hospital janitors, and stringing together our own personal purpose statement. So the question that I want to pose to you is, how will you specifically bring more purpose into your leadership? What is a strategy that you can start implementing today? And I actually brought someone in who happens to be my sister, who is a surgeon at Kaiser in SoCal. And I wanted to ask Dr. Weiss to talk about, she and I have been having a lot of conversations about purpose in the context of the crisis. And I thought it might be helpful to have someone who's not in an academic role in the same way I am, but actually in the field like the rest of you, talk about how purpose has been a part of surge planning in LA. So Jen, will you share with the group some of your thoughts about this topic?
Well, thank you for having me. I know you're here to listen to the smarter Dr. Weiss, but I am thrilled to take a moment to share with you how Leah's work has influenced me and the work that I'm doing. I've spent really the last 5 years of my life being a little bit grouchy, quite honestly, about where a lot of physicians are in the world of healthcare right now, and being grouchy about what I describe as this abyss that has been created between physicians and patients, created with language of calling us customers and providers, and created in these ways that are burning us out and really robbing us of our purpose. And what I found as COVID-19 has taken everything that we know and brought it into turmoil, a silver lining. And that silver lining is that this reconnection personally with my purpose of taking care of patients and no longer finding this abyss between me and them. And more importantly, I am finding healthcare in my world to be moving in a very healthy direction. And that is a shared mission. We're all in my organization understanding what our purpose is. Our purpose is that there are people that are at risk of dying. And so as we started to create our surge planning, we were taking what, I hate to use the word, but I'll use it, the stakeholders, and bringing us together to understand how to best approach what we were going to do to keep people from dying. So it doesn't get any it doesn't get any more serious than that. And what we found was that with this common mission against this kind of faceless, omnipresent enemy, that physicians, of nurses, clinicians, administrators, project managers, we all just came together in this way of what do we need to do and how can we do it? And in fact, I was in the emergency room taking a shift the other day, and we were fighting over who was going to get to take care of patients because people are just so mobilized to do the right thing. I think specifically an interesting, very early on in the process, I had an interesting call with Leah. I called her and I said, I have a really hard conversation coming up today because there is a leader who I think is detached from what I think we're all viewing as our purpose. And I was worried that this particular leader was not in touch with with connecting with the purpose of keeping people alive, quite honestly. That this leader was worried about protecting a set of people and that they might be asked to do things that they don't normally do. And it was really simple after I connected with Leah and was able to kind of reprocess all of these learnings of purpose and compassion, because I was able to connect with this leader and say, okay, number one, I am really grateful to share with you that we have taken a poll in a grassroots way of what this set of physicians wants to do, is willing to do, and actually is hoping to do. So the purpose of the people doing the work was really important. And also to be able to call in, have him recall his purpose in all of this. And the conversation that I ended up having with him was just smooth as silk, because making those suppositions were very easy. One other piece that I think comes to mind for me in all of this silver lining of COVID is the inner drive that physicians and clinicians have. And I think that most of the participants on this call are not physicians and clinicians. Maybe you were, but I understand that now most of you are in administrative roles. And there's a wonderful book called Drive by Daniel Pink. And it really pertains to this situation. When you let people in a grassroots way do what they're meant to do and give them a sense of driving their own purpose, what you get from them is tremendous and immense. And I'll say one more thing before I hand it back off. I noticed the people in my office shifting. So people who might have viewed themselves as coming to work for jobs or even careers have shifted to a calling. And I'm not talking about the doctors or even the nurses. I'm talking about medical assistants, technicians, clerks, people who are really feeling proud to be part of the essentialism of what we're doing to help patients right now. So I just am grateful to having this language to be able to help me with all of this process. And I will hand back.
Thanks so much, Jen. So I was hoping that from hearing application in context, always helpful. And my hope is now to open the floor to questions for you around how will you bring more purpose into your leadership? Is there a specific strategy that you're already using or that you could take forward and start using with your teams, with your organization? If anybody wants to unmute and speak live, I would welcome your voice, or if you feel more comfortable in the chat bar, also fine. Maybe if you want to speak up, just type in the chat bar, I'll talk, and unmute yourself and go for it. But yeah, we saw a comment before that, wanting that the utility of these kind of ideas for huddles or team meetings, bringing forward when we're trying to rally people around work that needs to be done at personal risk. Purpose is an invaluable resource. I'm curious what examples you have of how you're using purpose or what more you could imagine doing. If anybody on the call is willing. Thanks, Shirley. Yes, the video call will be posted, so you'll be able to see that again afterwards. So any other, here's one. Great, yes, Vic Stretcher's work is wonderful. I assigned his book in my class at the business school. The graphic novel that he wrote about purpose, he's done a lot of really good research. And he also has colleagues, that list of biological markers that I gave, a lot of those come out of his co-faculty at Michigan. And definitely highly recommend for people who are interested in this topic. His work is really great. And his interest in the topic came out of losing his daughter and finding resilience. And I think often this is an interesting theme for people who are interested in this topic of purpose and resilience that comes out of loss. And here's another example in the chat bar, reminding staff of our mission and that the community is counting on us. And I think that sounds like a really important, the high level, what are we here to do? Coaching health home teams, the first item in the agenda is to share the positive impact on clients, unexpected patient change, expressions of gratitude from patients. This is rocket fuel for rekindling purpose in a shared, connected way. That's a great example. That is like an ideal example that when people can, it's getting them to connect the puzzle box top with their experience, the impact they're having. And Bridget has a question here about blending and honoring the skills of a team that has a mix of job, career, and calling. I think a really interesting way to work with this in the context of a high pressure moment like now is actually potentially doing something like taking the quiz that I mentioned before as a resource to see how are people oriented, how are they energizing themselves, how are they dealing with stress, and understanding the different types of personalities, using that as a springboard for conversation. How can we support one another based on our own and one another's patterns? So if you have one person who's a workaholic, who's gonna, the more stress they get, the more they're working. You see them online at 8, at 9, at 10 at night, and really early in the morning. If you see that's part of their stress typology, then you could support them by, saying, hey, I noticed you're sending emails like really late and really early. And, appreciate the hard work, but is there some way we can help you, to take care of yourself? Or for some people, they're more avoidant and they might be MIA when they're under stress. So understanding that can be a personality kind of coping strategy. So yeah, and I think these are really interesting. Taking these conversations back to your teams, I think, is a really important question of like, where are you feeling a lack of purpose, lack of support? Asking people for examples of the extra role behaviors that they can, that you can support them in investing in, even a little bit of time, something that they want to learn or do or accomplish that might not be a core part of their job description. If someone who feels a job gets that invitation, they're going to feel supported, and that will automatically help change more of a sense of purpose. So I noticed that we're getting very close to the end of our hour, and I want to make sure to give the back over to Marie to close out. I think the last things that I would say are to be in closing, that to remember the basic principles of behavior change, that taking these small steps lead up to the big actions and the big changes in our lives. So remembering that as individuals, that if we want more purpose, there are these small steps of getting more clear on our why, getting more clear on extra role behavior, getting clear on our stress. And the same for our teams, that understanding and supporting in the small ways that people are talking about. I love this metaphor of rocket fuel. So we create the rocket fuel when we take the small steps and when we take them together. And so I'm looking forward to further exploring the topic of resilience in the upcoming webinars, and I'll pass back over to Marie to close out with invitations and more context. Thank you for participating. I know it is a busy time, and I think it's particularly meaningful for us to come together and pay attention to resilience and risk for burnout, and what can we do to support shared purpose. And I'm grateful to all of you for what you're doing, for keeping healthcare systems going now, and your role in that. The NASA kind of metaphor, I'm doing a project over there, and they literally, it is just part of the ethos that every last engineer and mechanic is just as important as the superstar astronaut. And I think that that's the right metaphor for everybody in healthcare. Every one of you is mission critical. So thank you, and thanks for paying attention to your own resilience and purpose. Marie?
Yes, thank you so much, Dr. Weiss, for this amazing webinar and time that you shared with us. So before the final closing, there should be a poll popping up on your screen. And I also encourage you to answer this question that I've just put into the chat box, which is how can future resilient leadership webinars or additional CIN programming better meet your needs now? Just want to get a little bit live feedback from those who are on the call. So please both take the poll and answer the question that I've just put into the chat box. Again, this webinar was recorded, and we'll be able to share the recording with those who are on attendance today, as well as others who've registered for this webinar. To sign up for the remaining webinars in this series and other technical assistance resources, please go to CIN's website at www.chcf.org/CIN. Thank you all for joining us, and we're looking forward to seeing you next Friday.